Good morning, everyone. We are the Group 3 Oxygen, and today we're going to discuss our answers for our Activity 2 Philippine Healthcare Delivery System. So, we are tasked to watch videos pertaining to our healthcare system here in the Philippines, and these are the following questions we needed to address. What are the immediate healthcare needs of our community, our country, and the world as a whole? What are the pressing issues in our society that have a great impact on our healthcare system? What issues or needs in the healthcare system will the universal healthcare law address? And lastly, if you will be given a chance to be in a position where you can implement change and pose solutions to our healthcare issues or needs, what would it be and why? What are the immediate healthcare needs of our community, our country, and the world as a whole? And this is our shared response to the question. We deem that our immediate healthcare need would be the accessibility to healthcare through primary healthcare. So, through the primary healthcare, we could have the needed prevention, education, and health promotion to cater to the community and most especially to our underprivileged sector. Access to these services are very significant in order for everyone to be knowledgeable and aware enough to take care of themselves and prevent possible illnesses that can occur. It is also mentioned in the video in comparison to the US where healthcare is pretty much accessible and everyone can go for checkups. Dr. Posada said that in the Philippines, many people die before seeing a physician or before even going to hospitals, which is why it is needed that people should be provided medical assistance through primary healthcare so that they would be helped before they would even get sick. So basically, accessible and inclusive healthcare through primary healthcare services could address and help lessen health-related problems and even death rates in a community or even in a global scale. What are the pressing issues in our society that have a great impact on our healthcare system? The lack of adequate financial and liable support from the government could be the root of a worsening and ever-growing health crisis, in which affects the most vulnerable in our society. As also mentioned in the video, it is seen that our health workers are pleading to be supported and to be funded, especially for government funds to be allocated to bettering our healthcare system here in the Philippines. We think that with enough funds to fuel programs and organizations that caters to the needs of the community health-wise and as well as allows for better compensation or pay given towards our health workers, we can then bridge the gap between our communities and accessibility to services that are of quality. With this, we can help people have access to proper medication and appropriate services. We can have health workers that are more driven to serve, and ultimately, we can address health related concerns and even socio-economic concerns in the community and promote better health for all. What issues or needs in the healthcare system will the universal healthcare law address? So what we've got is that the Universal Healthcare Law targets to improve access and capacity of healthcare goods and services, improve or increase the capacity of its delivery systems, establish a network for better coordination and accessibility of data between healthcare facilities, health promotion, and then strengthen health technology through a health technology assessment council. Generally, the UHC law is expected to make healthcare be equitable and accessible to everyone. For the last question, if you will be given a chance to be in a position where you can implement change and pose solutions to our healthcare issues and our needs, what would it be and why? So in this portion, my team members and I have shared our own unique points regarding the question. So we thought that it is important for every input and thoughts to be heard. So bear with us as we read each one of my team members' answers. If I were to implement changes and pose solutions in our healthcare issues, I would like to have a fair or equal access to healthcare for all people. Proper divisions of the budgets should be implemented. We should also have high quality and cost effective medical equipment so that we can access different health issues. Improvement in the service and the staff itself should be addressed. Having high quality equipment would help our medical staff to have much accurate and more helpful solutions to patients' issues, and having this may also help us in having good quality service. I want these changes to be done in our healthcare system because I want people to enjoy a high quality service but cost effective medical healthcare offered by our own country. I think in the area of health financing, because many Filipino cannot still afford medication in spite of having a PhilHealth system. Many people just stay in their homes. They don't go to hospitals because it is expensive and not all expenses will be covered by PhilHealth. It would be the sufficient allocation of budget towards our healthcare system, especially in terms of the financial compensation given to our healthcare workers. The Philippines is home to dedicated individuals, passionate to serve in the medical grounds, and is often recognized to be the best to breed excellent professionals in this field. Yet, it is also ironic that we cannot give the best to our own country. This is also not in any way to blame them, as they are only right to demand the salary that they deserve. But if we would only invest in genuine healthcare programs and build more efficient healthcare units, especially PHCs to the barrios and far-flung areas, we can actually make healthcare accessible to those who most need it and develop a healthcare system wherein all the stakeholders and workers are recognized and compensated well, allowing an environment wherein they would be much more encouraged and driven to serve the people. If I were given a position to assess the issues in healthcare, first off, it would be the proper issuance of the budgets in delivering the proper healthcare services provided by the government. Another is focusing on patient engagement, collection of proper data, collaborating with other organizations, and improving health outcomes that will serve as the rate of the healthcare services provided by the provision healthcare personnel. I will implement measures, protocols for attaining the measurement and specific definitions for improvement of goal analysis and data collection. If I were in a position to address issues in healthcare, I would probably focus on the financial support for everyone. Health will always be everyone's wealth. Everyone will be assisted and will receive essential care, whether it's for newborns, for pregnant women, or for people with serious diseases. Proper facilities will take good care of people that are less privileged and need hands-on health essential care. Women and men, whether they are rich or poor, will receive equal health services and proper treatment. There is no privilege when it comes to health. I want everyone to have a fair and equal share in giving and receiving proper healthcare services. First and foremost, I would impose the proper and sufficient allocation of budget towards the healthcare systems. It is to ensure that both the healthcare workers and the people would have the best services. Also, I would strengthen the accessibility of healthcare services by building healthcare facilities in every community, especially in remote areas. Since there is inequality in terms of access to hospitalizations, I would create partnerships with both public and private organizations to help those people who are struggling to pay for their bills. According to the Alma Ata Declaration, our health is a fundamental human right, and it is important that each one of us should attain the highest possible level of health. And it is just and fair that each one of us should also be given equal access to healthcare facilities and services. If I had the opportunity to implement a change or solution to one of our healthcare system's problems, it would be to provide equitable healthcare to everyone without compromising their financial risk. I want them to have the opportunity to exercise their right to receive high-quality health care. Also, I want to emphasize the importance of enhancing our healthcare facilities by providing funding, because the pandemic has made us realize the shortcomings in providing healthcare, particularly in terms of supplies and facilities for those with limited financial resources. And those were the articulate answers of my team members, and that concludes what we have to say about the Philippines healthcare delivery system. Thank you!